uploaded?
I am here and I am on.
Okay, perfect. Well, let's go ahead and get started. So welcome everyone again to our webinar series. And today's webinar, we're going to be talking, as you can see, about AI in dentistry and specifically around diagnosis case acceptance. And this has been something I've been quite passionate about over the last year and a half since I've been exposed to AI. I was actually one of the earlier beta testers, flew across the country to see it in action in the earlier days. And so I've been super excited to have this webinar this evening. Just some housekeeping stuff first. If you have any questions that you think of, please type them in the chat and we will do everything we can to get those questions answered. Sheila, I might interrupt you every now and then to ask some questions. Also, we hope that this this webinar will last about an hour. We'll see how long it goes. And then if for whatever reason you lost connection, I know like there's a tornado warning in Dallas, for example. So if you're losing connection, we'll go ahead and reach out to us and we'll try to get you a copy or recording of the webinar. All right, so Sheila, I'm about to pass over to you. For those of you that don't know Sheila Roth, she's the Director of Clinical Operations at Pearl. And it's been so wonderful to have you take time out, Sheila, of your evening and share your knowledge with us. So I'm going to go ahead and turn it over to you. Take it away.
Excellent. Well, thank you so much for having me. I am delighted to be here. Thank you for your patience. I'm going to dive right in. I'm very excited to talk about AI in dentistry. And let's jump in. So I want to make sure that everybody's aware that I remember back in the day when we started focusing on how do we move from digital imaging, regular imaging, all the way into digital imaging, right? And that was a big jump for all of us. And I want you to think about that time where we were wondering, is it going to be better? Is it going to be easier? And now we're here again looking at, do we really incorporate AI? And today we're going to walk through what is AI, how is it working in dentistry, and what is it doing in our life for impact, and how is it really going to serve us as clinicians, and most importantly, our patients. So thank you again for joining me. And let's start with a little bit about what is AI? Where did it come from? We hear it everywhere in the media, and it's really simplified into teaching a computer to do some simple things. Again, we'll talk about how we've all been using AI. It kind of snuck into our world without any notification. Today, we're going to really focus on two different types of AI. We think about AI in a general sense, where it's the Terminator, it's something coming to take our jobs. But what we're talking about today, especially in radiological AI, is that narrow artificial intelligence, where us as clinicians can look at a patient, we can look at caries assessment and medical history, and how is the bleeding doing, and how is the patient feeling, and are they stressed? That's more of a general human ability. Narrow would be, I see an area on an x-ray that's a little shade of gray, and I can learn that that's a cavity. So we're going to keep in mind today that AI is not here to replace us, right? It's here to make our lives easier and better. So a little bit about how AI is trained. It's important to know, too, that we take a lot of data, and really the term AI has been around since the 50s, right? They've been studying AI and computer vision for a very long time. It's not till about 2017, 2012 to 17, right in there, where we started getting larger sets of data where we could make more performant models by doing more training. We had more computing power, and now we're able to use AI in a very simplified, scalable way and have output, Siri, Alexa, radiological AI. So how is it trained? It's very similar to learning new things. And for example, we think about, how do we teach AI to learn what a Dalmatian is, right? Well, we put a bunch of different pictures of different dogs in there, and it had to learn that this is a Dalmatian because it has black and white spots. Very similar to training radiological AI, right? We had a lot of clinicians all around the world, and we were able to have them circle cavities, circle periapical radiolucencies. And that is how AI actually learns. AI in everyday world comes really in four main versions. We talked a little bit about generative AI. Computer vision is when we're talking about facial recognition. Natural language processing is coming soon to dentistry, if you haven't seen it already, where it's going to be able to really allow us to have that chart documentation done for us. And machine learning is also a part of the, wonderful world of AI that we're living in. So think about how you're using AI every day, right? When you go watch Netflix, it's telling you, hey, based on the last 10 types of shows you've watched, this one might be a good choice for you. And again, back to natural language processing. Hey, Siri, hey, Alexa, and again, notes and charts. So I'm not sure if any of you have started using voice AI for periodontal charting. That's also a huge asset. And if we stop for a moment and think about that, that's a great way to use AI to be able to think, this is going to save me time. And ultimately, I have more time to spend with my patient. So again, moving through how AI came to our world, we see automotive safety. We see where that we're thankful that the car will stop for us, right? If there's something behind us. And now let's really start focusing on what we're talking about today. Dental radiology. This is a funny picture. We told ChatGPT to go ahead and make an image for us, which is a dentist looking at x-rays with AI, radiography, and Santa Claus. And it's interesting to see how far AI has come. Photo enhancements. This is one person here, right? With 3 different versions of that same person. So we look at AI in business, logistics, data analytics, customer service. This is an interesting statistic. 35% of businesses globally are using AI today, and 42% of businesses are exploring AI. We look at it in healthcare and how is it improving our lives. This was an interesting statistic that showed us that when we put AI into mammography, we saw that there was a 20% increase in detection. Now, what we learned by that is it wasn't false positives. They were not incorrect detections. So we think about how is that going to really shape dentistry. When we think about Pearl, I was really surprised to see too during our FDA trials that the dentist would look at radiographs, not perfect always. The AI would look at radiographs, not perfect. And when we combined the two, we were able to see that 30% more disease detected. And what you're seeing here is Pearl's second opinion, where you have live pathologies read within seconds. So you have periapical radiolucencies, you have caries, notable margins, calculus, lots of areas of concern that we're discussing with our patients on a daily basis. And again, reminding ourselves that AI is not here to take over, but it's here to provide additional data sets for you to be able to move through those radiographs faster. I'm sure many of you are familiar with diagnosis fatigue, right? And having the theory that spell check is there for you, right? We all write emails, type letters, and we see those little red lines underneath our words, and we're like, no, actually that's the correct spelling of Sheila. There is an IE versus 2 E's. But in reality, that's what it's doing for our radiographs, right? We're moving through our day so busy, especially owner doctors. And, we're anesthetizing. We run over to Op 3, we do a quick exam, and then we have a quick question because there's a patient up front. And at the same time, it's nice to have that second set of eyes on your radiographs at all times, reminding you, Bob maybe is here today for, that area of concern that he has a broken tooth. But what about number 3? It looks like there's a lesion that's actually progressing through that enamel today. So it's amazing to be able to think that our patients have better care, but ultimately that our dentists are able to make that final diagnosis. When we look at AI in dentistry, some of us have used AI already to, again, we talked about voice probing, chatbots. Sometimes it'll also even help return phone calls, right? Send text messages. We're thinking about how we're able to hover over an opening and look at the potential patients that would fit in there per doctor, per procedure type. And again, we talked about radiological AI, being able to see that incipient lesion, right? It's light pink compared to a darker pink where it's past that DEJ. And being able to start sitting back thinking, wow, this would be really helpful for me, but ultimately helpful for my patients. Now imagine that we've looked at the radiographs, we've pointed out some findings for you, even on previous images, and also in the same exact moment, we've verified that patient's insurance. So your patients now come to your office prepared to be able to focus on that wonderful thing, have that great experience with the doctor. All of our patients want to leave, right? And say, that was fantastic. I don't have any cavities, right? But when they do, it's nice to have that image to be able to explain to the patient what we see as clinicians, right? We look at the history of modern dentistry and we look back from the 1800s where we started, thinking about little things like toothbrushes, and look how far dentistry has come. And these technological advances are really what's pushed the industry forward. We saw a huge boost with aligners, and that was also AI. So now we're at a point now where radiological AI is the next innovation in dentistry. I think it's very exciting to see that these simple things that we deal with on an hourly basis as clinicians are now visible with more data in real time and in a patient-friendly format for your patients to understand the dentistry you're recommending. So we see on the upper left-hand side where you see the areas of detections here. Those dark pink areas are areas where that decay that's proposed for you to review has passed through that dental enamel junction. When we see incipient lesions, whether we're going to keep an eye on those or whether we're going to remineralize them, they're going to be in a light pink. So a lot of times by the second visit, the patient comes back and they say, doctor, I've been flossing. I'm hoping that light pink lesion hasn't turned to a dark pink. How is it looking today, right? And I think that really starts to involve your patients. We have bone level measurements. So hygienists, when we see those bone level measurements turn from white to yellow, that's a warning sign to just very quickly take a closer look. How is my patient doing periodontally? Do I need to do a spot probe? Do I need to do a full mouth probe? And then full teams that are using those same images to be able to send them directly to insurance companies to decrease those scaling and root planing denials that we all would like to have the teams pay for more often. Calculus is great. It's great as a hygienist myself, being able to know I may have missed the distal of 15 after that SRP, but really, when I turn that image to my patient, they're now understanding what those areas of calculus are. There's a little box around them. I don't have to show them this little spur or draw a circle like we used to do or hold up pencils to show bone levels. That's really impactful, especially on a new patient. So thinking about how we're infusing trust now, because they're able to understand these areas of concern, especially when we're focusing on bringing it into the full segmentation, which I'll go through in a moment, where you're seeing natural anatomy and you see a cavity go through enamel, and it's visible for them to see that on a radiograph now in color. Interestingly enough, 49% of periapical radiolucencies go undetected on radiographs. That's very high number. And so having, again, those asymptomatic lesions just pointed out to you, doctor, take a closer look. How is this patient doing? Is it getting larger? And you're able to focus on the best clinical care for your patient. Notable margins, those are always interesting to see, right? And again, focusing on how are we going to use an image like these colored images to share those chairside with our patients on every exam. So we all do believe here that AI will be an essential utility across the dental field within the next 5 years. And dentistry is very well suited for radiology for AI radiology, because our profession is responsible for taking the most amount of images annually. In fact, 1.4 billion dental radiographs are taken per year. That's a lot of x-rays. So our profession has actually leapfrogged over medicine when it comes to AI and innovation. I think we are also all on this call, unfortunately, aware of the patients distrusting in our profession. They come in all of the time for a second opinion. I would have patients come in with a very long list. Do I need scaling and root planing? And do I need lasers? And do I need, subgingival antibiotics and stuff? And I would probe and I would see maybe 1 4-millimeter pocket, right? And this is the same for doctors. You guys get this very long list of multiple restorations. Now, that doesn't mean that there's difference in diagnoses, but 3 major studies we can see here, and I'll walk you through these. It's a lot of interesting findings where we're still having that unfortunate inconsistency, and that is leading to patients still not trusting. So Pearl has created a AI council, and we took one FMX. We sent it to 136 different doctors, And what we found was that they really could not agree on decay. So they were looking at one image and they were saying about 4% of the time they were able to agree that there was decay on a certain tooth. In fact, the radiograph, the FMX was showing that $300 all the way up to $36,000 was the diagnosis for that one FMX. Now, doctors always ask, well, they couldn't see the patient clinically. So yes, being able to diagnose just from that one FMX, but to see that vast difference of that small amount all the way up to almost a full mouth rehab was very surprising. I'm sure those of you that remember the Reader's Digest study back in the day was when a journalist went to 50 different states and got 50 different diagnoses, and they were completely different. And he reached out to the president of the ADA at the time, and he said, you have to get a lot of different opinions. And he's like, I got 50. How many more do I need to know? And so this is happening in our space still. And we are in a lot of different schools focusing on training the students. So UCLA is using Pearl now, found that the fourth year students had about a 50% ability to pass when they were looking at caries. And UCLA also showed that Pearl was able to have about a 95% accuracy rate in those radiographs. The last study I'll go through is kind of more telling to all of us because, again, the dentist looked at about 9,000 images. They agreed about 5% of the time with the fact that this was actually a cavity. Now, it wasn't, are you going to treat the cavity, right? It was just, is there pathology here? But they came back 90 days later, and they only agreed with themselves about 70% of the time. And so that tells us, right, that we are all human. We do have that area of concern, and it is nice to have an unbiased second opinion. So if we look at some of the data here, it is surprising that 43% of these caries do go undiagnosed, but also 20% of cavities are actually not cavities once they're opened up. So how can we be a little more consistent for our patients? According to additional studies here, it's about 64% of patients say they do not understand the x-rays that the doctor was showing them. And I think that was my passion for coming to Pearl, because I fell in love with the fact that we could actually have something to show a patient, to have them accept the dentistry earlier. And so we would see, recurrent decay. We would see areas encroaching into almost the nerve, and the patients, oh, it's fine, I'm just going to leave it, right? And unfortunately, those areas become more expensive to the patient, post-op concerns, and clinically, losing more tooth structure is not fantastic for a patient. So I think we can all agree here that the quality of dental care begins with an accurate x-ray analysis. You remember back in the day, right, focusing on those developer rooms. And that's what I want you to think about, is when we all really had a hard time focusing on moving from regular radiographs and the lack of diagnostics and moving into digital imaging. And I think we're here to say AI is something that can be adopted much earlier as well. So I'd like to go through, I know we can't share our screen here, but you guys can't. How many areas of decay do you see on this image? Now, what I want you to do is know that you're probably sitting at home, hopefully, and relaxing now, and you're not being distracted, right? The phone isn't ringing. You don't have other hygienists that need you, or other patients that are waiting with a rubber dam on or something. So clinical review is something that can be really enhanced by being able to have this second set of eyes appearing in real time for you. So hopefully you saw those 4 areas of decay. Now, the idea here is to think about images where we look at teeth 28 and 29. And what we are not saying is you should go fill those teeth. And I think that sometimes the concern with AI is it's telling me what to do. And in fact, it's really identifying pathologies. The human eye can see about 30 to 50 shades of gray, whereas the computer can see almost 500 to 700 shades of gray. When you hover over these areas of concern, you will also see within that segmented lesion, what is it compromised of? How much decay is taking up the enamel or the dentin? And this becomes very powerful when you're looking at those E1, E2 lesions, right? So same thing for hygienists. When we're looking at these areas, a patient comes in, they just want their simple free cleaning, their toothbrush, and all of a sudden we're talking about 4 quadrants and, 4 visits or 2 visits. And so as a hygienist, it helps you be more clinically aware, just like a dentist with those lesions. But at the same time, for the patients, they now can become kind of a co-diagnoser with you once they understand what's happening in their mouth. So let's turn to the operatory, right? This was an interesting story. So one of my best friends, her daughter had taken about 4 years off of going to the dentist. And before that, she had been at a pediatric dentist for a very long time, had no cavities, and came to my old practice I used to manage and said, hey, you're still working for that office, right? And I said, oh, I left a couple years ago, but what's going on? And she's like, I don't know if you guys have like new doctors there diagnosing more dentistry, but Kendall's never had any cavities before. And she went to your office and they told her she has a bunch of cavities. And so I said, well, I'm happy to meet you down there. We can talk about it. But lo and behold, Kendall has a lot of cavities and had just as many on the left side of her mouth. So what I thought was really interesting here was for the fact that Pearl was able to show these incipient lesions versus the areas that really possibly passed through that DEJ and allowed both the patient and the clinician to very effectively come to the conclusion that they were going to fill number 30 and keep an eye on the rest. The patient was happy, the mom was happy. Now, I like this case because this is very common for all of us. We're really focusing on bite wings. We're looking at interproximal lesions. We have multiple lesions and we're sequencing. When do we fill? When do we wait? When do we remineralize? When do we open the tooth? And also we can very quickly figure that out as a clinician, but then how do we explain to Kendall, you have 15 cavities, we're going to fill 2, right? And how do we arrest those? And that's an entirely different conversation. But now we have the ability to have more data, to make more informed decisions, and to educate our patient so that they will accept the dentistry earlier and more often. We're finding that especially having the segmented lesions appearing in color, a very simplified approach allows dentists to build more trust and ultimately enhance that case acceptance. The magic really occurs in the hygiene room or with the dental assistants because hygienists, we're seeing patients for quite a while, right? We do that handoff. Bob's here today, doctor, and I did take a new x-ray. He said number 4 is not bothering him, but we have it on watch if you could take a closer look. I'm seeing an area of pink over here. I think there's a concern. Same thing with the dental assistants, right? When they walk out of the room after the doctor makes a diagnosis, says, see you soon. We'll see you for that crown on the upper right. And the patient always looks at the dental assistant, right? And says, what did the doctor say? Or do I need that? So this really becomes a full team tool for educational purposes. And again, ultimately having that patient understand what you're recommending. Another silver lining that's been very interesting is when we think about how much time we spend presenting to patients, it's about cut in half now. So what I mean by that is you don't have to talk about shades of gray for a very long time. Explain that enamel is the white healthy lesion, right? And that it shouldn't have a triangle there, or you shouldn't have a spur of calculus. So by the time we finish our presentation, we have a lot more time for the patient to actually ask the questions, be able to sit back and have a couple extra minutes to spend time with them. And that's really where the magic happens here for patient retention. We talked a little bit earlier about using these images in a simple printout or PDF to upload into a claim. And that's been really helpful for teams to be able to see a lot more claims paid faster. And also a lot of our teams just took their images, resubmitted the Pearl images with the bone level measurements on here, and were able to see a lot less denial. So they just decided, well, we just send all of our images directly from Pearl to our insurance because those bone level measurements from CEJ to bone crest shows that there is bone loss on this radiograph, which is really kind of what they're looking for in addition to that basic documentation, right? Which is that full mouth probing and the narrative and recent radiographs. But we've all seen these same images where we keep an eye on that area, which probably should have happened in number 3 distal here. But now we see that it's already progressed and those 2 different colors have changed, right? So the patient was aware, okay, got to get a filling now. When we're focusing on diagnostics, think about those simple things that are coming through your radiographs on a daily basis, right? Do we always look at that area of concern at that apex? When I was working in my practice, a lot of the times we spent focusing on training new associates. And what I found was very interesting was they felt so many different things when they first started, right? They have that fear of rejection. They have the, how do I review the radiographs? It's so fast. And how do I look at the chart? And how do I learn what the owner doctor would recommend? And that's a lot to do when you come right out of school. But there were so many images that the patient would be in the chair, the doctor would go to start prep, take that extra PA. He didn't see that periapical radiolucency. That's a very uncomfortable conversation with a patient, right? We went from a crown to a potential root canal. And so being able to have these pathologies occur on the radiograph for you has been extremely insightful and very helpful for patient care in general.
Yes, Sheila, I'm sorry to interrupt. If you can go back a slide. We had a question. You've answered it, but maybe we can just hit the answer again. The question was actually the slide after that. Does this help diagnose bone loss along with caries? And of course, like this slide is absolutely showing, we've got incipient decay in pink, we've got decay into dentin in a darker color pink, and then all of the yellow kind of measurements around the bone, that is actually kind of warning that, hey, there's probably some bone loss there. Of course, it's also got squares around the calculus. Did I say all that correctly?
That's spot on. You got it.
And another point to this, something that I'd like some of you dentists think about, we're out buying practices sometimes. And you buy a practice from an older dentist that has kind of been doing things the baby boomer way. And they maybe they've been kind of slowing down their practice, slowing down their diagnosis. We buy the practice and we just see problems everywhere in patients' mouth. And we're in this very difficult position of having to say, like, you need all this work when they're thinking, I want to see Dr. Smith again. He never said I needed this, right? So AI helps us kind of stand back, and instead of having to be the convincer or the influencer of this patient who's skeptical, we're now the teacher of the technology. Mm-hmm. So if I were buying a practice, for sure I would have AI scanning all the x-rays and be part of every single patient conversation I have with the existing patient base, where I've got to now tell them, you've got bone loss and you've got cavities, for sure.
Absolutely. I think it's really insightful too, what you're saying, because we want to make sure that there's clinical calibration, right, amongst the staff. And the same thing used to happen where I don't know, I'm going to go see Dr. King and see what he says next time. In the meantime, we've seen that when the doctors are looking at a case together and they say, well, let's see what the AI says. That's been really helpful to have that unbiased opinion. But definitely having the vision as a patient to finally really see the light pink versus the dark pink has been a game changer for case acceptance. In fact, in the first 30 days of using Pearl, we will typically see over 30% increase in case acceptance. And I want to make sure that you're aware that that is not increase in production, because that does happen. But at the same time, we are seeing that patients understand earlier and they're accepting more dentistry. And I think that's why we're all in this field, right? To take the very best care of our patients. Another great example of where the AI picked up all of these areas of concern, and the doctor focused on this patient. They had a very short amount of time. This was a same-day dentistry event that came out of hygiene, opened up 14 distal and did confirm that, yeah, that there was decay into the dentin. So it's been really an interesting time at Pearl to hear back from all the doctors. It's funny because I was having a conversation just yesterday and I was talking about Pearl, and one of the CEOs of a different company had said, wow, we're so interested in Pearl. So this is really best for like associates and new doctors, right? And it was interesting because the doctor that was sitting next to him said, actually, no, I've been out for 22 years and I think it has picked up more things that I have missed. And she said, not because I don't know how to diagnose, because I'm so busy and I'm so preoccupied, right? We're a profession that doesn't get to have this luxury of reviewing radiology in a vacuum. We don't get to just say, okay, well, I've looked at that MRI and I'm going to send it out for surgery over to Dr. Smith. Dentists are the diagnosers, the decision makers, and they're working on the teeth. So it's very challenging when you think about, if you just look at the studies on radiology review, it's really interesting how dentists are able to move through that so quickly and so efficiently.
I've got another question that popped up, if that's okay. Someone says, we've been using Pearl for a few months and it's incredible. The question I have is there a comparison capability to see changes? That was the first question they asked, meaning maybe seeing changes over time. And then also, should we be deleting areas that we don't agree with? Does that help AI learn? But for example, now I'm speaking from Scott, we can take an x-ray incorrectly and there's a lot of overlap, and AI may not know for sure if it should color it. So it's going to highlight it and say, hey, doc, come take a look at that. That could be something or it could not. When we feel like it's not something, should we be deleting it or marking it? Is that helping AI learn? So those are the two questions. Can we compare, and should we be like marking it or not?
Great questions. So the first one I will address is, yes, there is a comparison tool. So I showed an image earlier that shows you the images side by side. So you want to be able to see what areas of decay occurred and then how is it looking today. That disease progression modeling is very impactful for patients. So inside of Pearl, you click A/B. That's comparing those two images. You can compare both, and you can also have that segmentation with the tooth parts on. So I hope that answers your question. On the upper right-hand side, feel free to click on there and select the image you'd like it to compare to. And that's really powerful when the patients can see, especially when, the watch kind of patients, watch it get bigger. It's been a very, very impactful tool. The second question is also a great question, because a lot of times people, first of all, think that AI is perfect. So when they take an x-ray and they look at it and they go, I'm better than the AI. And the point is to be the AI plus the clinician yields the best results. You are going to see false positives. I think one of the areas that's really very challenging for AI is because it's reading shades of gray. When you see like the laterals, the maxillary laterals, and the rotated slightly, you're going to see that fossa sometimes pick up as that shade of gray. Interestingly enough, we are starting to pick up decay in overlap bite wings now, because the AI is becoming much more refined, as well as finding way more accurate critical bone level points. So in the last 4 years, it has really improved immensely. You may want to remove a detection on a radiograph, which you can do at any time. And it will stay if you'd like. It's hidden, but it can reappear. If that area of concern on the radiograph is something you don't want a patient to see. It could be a water spot. It could be something silly that came up, right? So we don't require you to interact with the tool, because that would be very challenging for you to have to always go in and edit things. The AI is improving on a 24-hour, every day, 7 days a week basis. So we have teams all over the world that are perfecting those models. AI is actually teaching itself now. So we do not need a clinician to interact with the tool. The edit feature is only there for your own ability to remove something if you choose to do so. By hovering over detection, you can just click it off, and you can also add something on if you prefer, like maybe you want to watch something. You can draw something onto the image as well. So I hope that answered the question. Are there any more other questions?
The only other question is kind of a general question. What will the future hold for Pearl?
It's a great question. So I'm going to show you in just a moment some of the additional AI capabilities that we're working on. CBCTs, again, using natural language processing to record your chart notes, helping you be able to write narratives. So a lot of those mundane tasks that we can do with AI so that you can spend more time with your patients, those are the problems Pearl is trying to solve, because we're very provider focused. So as we move into a small case study we did here with a couple practices, and I think there was 4 practices combined, we saw this increase in treatment acceptance in the first 60 days. So just by showing those images chair side, we saw that increase in treatment acceptance in endo, in crowns, fillings, implants, scaling and root planing, and even in those restorative treatments. So those studies are also available on our website. I do want to walk through something that's very interesting, because what we're doing now is we're taking our radiographic insights that are all inside of those x-rays, and we're going to now marry that with your practice management system. And what we do is we'd say, Bob's coming in tomorrow. The radiograph here shows there's a couple lesions. The treatment plan has nothing on it. Doctor, please take a closer look. So we now have the ability to look back 18 months, review all of your patient's images before they come in, and then we are going to let you know if there's something on the image that's not in the treatment plan. It could be a periapical radiolucency. It could be an incipient lesion. It could be notable margin. It can also be that there's a lot of bone loss and calculus, but the patient's scheduled for a prophy. So a whole image review has been done, and we're going to give that to you in a color-coded schedule, and then allow those actionable insights to also be distilled in a per provider roadmap each day. Now, the reason I love this is because you're able to focus on areas that have already occurred on the x-ray. Your patient comes in today, you can look at those images, and then also there's a potential for you to be able to use AI to have more same-day dentistry and also organize your day. The other nice thing when we look at these provider daily huddles is how many, well, I don't know if anybody here could say they have a perfect day every day, right? No cancellations, zero no-shows. We should definitely host them on a webinar, because that would be wonderful if we could solve that problem. And unfortunately, we have about a 10 to 15% cancellation and no-show rate on average. But if we are able to really focus on all these patients are coming in today, is there any dentistry that we can focus on doing today? And they're in hygiene. I now have the ability to say, great, this hygienist, here's all of the unscheduled dentistry. Here's the patients now. We will tell you if they're due for x-rays, if they're due for probings, if there's a miscoded prophy, so accidentally you went from scaling and root planing over to a 0110 instead of a 4910. We want to highlight all of that stuff for you, as well as doctors. You have a bunch of patients today. They don't have their hygiene appointments set up and they're overdue. This allows for the best crisscross ability to fill your schedule. So a lot of hygiene patients that have unscheduled dentistry can move over to the doctor side, and a lot of doctor patients that maybe are getting a simple restorative treatment can stay and fill the hygiene schedule. So a click of one button allows your team to fill those openings same day with the patients on your schedule. Now, keep in mind, AI is able to look at every patient every single time you schedule an appointment. So hygienists don't have to go to work anymore early and look at every patient. Do they need probings, x-rays, exams? And the front desk doesn't have to go do a full chart audit. You can also, if you don't do a morning huddle, you just hand these out to your providers as they walk in the door. So this has been really helpful for teams to buy back time and take the very best care of their patients.
Yeah, one question kind of related to this, and I might be able to answer this, but it says, when the comparison of previous images to the treatment plan, they asked, is there a filter for treatment that was already done since those x-rays were taken? And if I'm to understand this correctly, because Pearl is not just looking at the x-rays, Pearl's looking at the practice management software. When you've completed that treatment, it's been posted. Pearl sees you completed that treatment, and therefore it knows, okay, the decay on the distal of number 3, there was a DO done on number 3 since that x-ray was taken. Therefore, that is not something that needs to be marked as undone. The question, though, is it still showing up on that x-ray? And I would imagine it is showing up on that x-ray, because that old x-ray had a cavity on it. Did I say all of that correctly?
You said that perfectly. It's still going to show up on the x-ray till you take a new x-ray. But at the same time, if you have any areas that would say we have restorations scheduled, then we're just going to highlight those predicted lesions for you to review. But when you take the new x-ray and you have that restoration, then yes, you will no longer see that you have that pink dot on the image.
And another question, it's more a general question about, the data set that Pearl originally started using and is currently using. How was it basically trained? They're asking, where did the training data come from? And they're really thinking about like any potential biases introduced into the training process. So what trained Pearl to be able to start doing this?
Those are great questions. These are really, really detailed questions. I love it. Yes, it's really important that we do not introduce biases, both from clinical expertise as well as the data that we're receiving. So we had to focus on different ages, different demographics, different sensors, different parts of the world, and different clinicians, right? You don't just want one doctor circling all cavities and that's how your training is learned. So what we do is we really are mindful about our data collection and making sure that we are not introducing any biases, because those algorithms have to be really specialized so that they're always improving and learning. So that's how we were able to train our models and continue to do so. All right. So as we come full circle here and we think about, I come to work, my patient schedule is done. I have a full schedule telling me who needs x-rays, who needs exams, everything is done for you. And now on top of that, we are going to verify the insurance. And the reason that I love this last product is because it really does complete that full circle. So having a patient in the chair that maybe wants to stay today, or even if they don't want to stay today, maybe your schedule is completely full and you don't do any same-day dentistry. That's fantastic too. But we do want to make sure that the patients leave with their next visit, right? One of my favorite mentors had this webinar, talked about no matter what, get the next visit scheduled. And the reality was that really kind of made us lean into improving all of our systems, which was the exam went in a little bit earlier, the doctor was mindful about the diagnosis, and the front office team was able to start delivering the treatment plan before the patient leaves, right? When I was consulting, there were so many practices that they would literally let the patient walk out the door and say, we'll email you after we call and check on insurance, or I need to do the numbers, so I'll get back to you. And to me, that's such a strange concept, right? There's not, I don't know, in any other business where we go to purchase something and they say, we'll call you tomorrow, or I'll send you an email on the cost, right? Imagine if people were to do that with selling cars. I'll call you Tuesday and let you know how much it's going to be. Now, I know we're not selling cars. We're actually selling something much more important. So having the ability to know that your patient's insurance is verified for you ahead of time with those breakdowns that office managers love in the small summary allows for more same-day dentistry to occur, as well as more transparent treatment plans, and ultimately your patients leaving with their next visit, keeping your schedules more full. So not only do we verify the insurance, but we're going to give you a treatment summary. So we're going to say in the upper left-hand side, listen, here's the top 10 things that we have talked to office managers about that they want the summary. Does it downgrade? Is there coordination of benefits? Do we have, ortho coverage? Up to what age? Can my hygienist do fluoride? Can they take x-rays today? Right? And then in something very unique to Pearl is that we're able to look at tooth specific history. So I remember presenting dentistry to a patient back in the day, and I would say, okay, Mr. Jones, so your insurance may cover this. I'm not sure. I need to look into the last time that tooth was done for you. It's either going to be $300 or it's going to be $0. And that's a very interesting conversation, right? I know my practice, the majority of the patients, which were not that many, that left our practice were because they felt that there was some insincerity about the finances. And about 90% of the cases we reviewed were because we couldn't quote the patient effectively before they left the practice. So this has been a huge help for teams to be able to feel more confident, feel like the office manager has about 50% of their time back that they're focusing on verifying insurance to be able to spend time with the patients. I'm sure we could do an entire webinar on staff shortage. So anytime we can lean into technology to be able to focus on ways to satisfy a task that we can now think, okay, I don't have to do insurance verification as often. I can take this insurance specialist and maybe help me present more dentistry, right? I don't know about you guys, but when I managed a practice for 25 years, I had a running ad of hygienists, doctors, and assistants. And it's because we were always growing. We had 2,700 patients in hygiene per month, and we managed 23 hygienists at a time. But there's still a staff shortage. And now we have AI to do so many silly, I call them silly things for us, like auditing a chart for my hygienist, or finding ways to give me all of the patients that fell off my schedule last week on, Dr. Smith's schedule for crowns. These technological innovations are huge gifts to teams to be able to buy back time so you can build those relationships with your patients. So we talked a little about, one of the questions was, where is Pearl heading? I think this is one of our most proudest moments, where we're going to be focusing on 3D. And initially it will be anatomical areas. You can see some of the samples here. And then as we move into our fourth quarter, probably more so those wonderful lesions we're looking for, like periapical radiolucencies, and focusing on, more definitive things that we're really trying to nail down with. Imagine circling a small area of concern on a 2D image and trying to train a model, and then just exponentially the areas of concern when you're looking at 3D models. So that is one of the areas we're focusing on, as well as, again, being able to walk into an operatory. I don't know how many of you have been to a doctor lately where you walk in and they look at you behind their laptop, right? And they're charting. Okay, so tell me more. How have you been? What's going on? How are you taking medication? All that stuff. And I'm thinking, well, I remember the days where the doctor would actually sit down and talk to you like a human. And we're moving in that direction sometimes, right? With technology requiring us to be doing all these notes in the charts and such, of course, with the digital aspect. But walking in, imagine having a toothache recorded for you, right? Tooth sleuth and endo ice and palpation and all of that done. And then it will actually summarize the note for you and be able to have you review it and then insert it. Take that with the ability to then focus on our next feature, which is our claim check tool. Imagine the patient goes to the front desk and you have an alert that says, Bob didn't have a new PA today. In order for his insurance to cover this crown, he needs a PA within 90 days. These are the things that the virtual assistant of AI can start doing for your practice. So I'm hoping that throughout today and this evening, you have found little ways to focus on, how can AI really start alleviating some of these mundane tasks that we're focusing on? And how can we use radiological AI to really have our patients understand that dentistry that we see when we're walking down a hall? We can see, 4 operatories, and you can see, oh, there's root canal, scaling and root planing. Okay, there's a crown. Looks like that patient has a lot of decay. But it takes us a very long time to have these discussions with our patients.
Yeah, Sheila, if we can kind of go a little bit outside of radiological AI, like when I think through a process of getting a patient in practice and treating them, we send out marketing and we have AI algorithms that's determining who sees the ads. Patient might call and the phone call is being listened to by AI. If we miss the call, AI answers the call.
Mm-hmm.
And, patient then needs to have their insurance verified. We now have AI automatically verifying insurance. It's an AI agent that's actually calling on our behalf. Patient shows up and, before they showed up, we had a staff meeting during lunch and I had the staff meeting recorded by AI. So I had notes. Maybe I had to write someone up for something. I had a conflict with HR and I had it recorded and AI gave me notes. We see the patient and we have radiological AI that we're using for diagnosis, for case acceptance. We've got perio charting AI as well. And it's just pretty remarkable, how fast this has happened. Even when I give a seminar, one of my business partners, he built out and trained AI to have a variable way of creating custom seating charts so everyone could pick their seat. And as we got more people registered, all the seating chart stuff is being done by AI. It seems like a stupid, tiny little thing, but that little thing takes up a lot of time and is stressful. This has all happened in like a blink of an eye. And I would argue now that we have an ethical responsibility to utilize radiological AI. We're dealing with diseases that can spread. We're dealing with body parts that can fall out, pain, tens of thousands of dollars or more, cosmetic issues. And in any other body part, I'd want AI checking my wife's mammogram. I'd want AI looking at, for example, I had 11 years of really bad back issues, in and out of a wheelchair. We had a hard time knowing exactly what to do. I would like the assistance of AI looking at those radiographs that are so hard to read. So, we're almost to the point where this is like an ethical thing now. Like, how can we ethically say no to AI becoming a tool the diagnostician uses on every patient? I don't know how we say that we shouldn't be doing that anymore. So anyway, I've been very pleasantly surprised about this fast journey of AI, and I can't wait to hear of all the new things that are going to be happening as well.
Yes, I couldn't agree more. And, we even thought, oh, well, in our practice, we're thinking, oh, do we really need a 3D, a CBCT? Oh, yeah, maybe we do need that. And now it's standard of care. And I think that's exactly in parallel with how we will be thinking about radiological AI. Is when I first started at Pearl and I went back to my old practice to visit, and they put Pearl, and I was looking at x-rays and I thought, how did I ever look at x-rays without AI? And that happened within 6 months of being at Pearl. So I do think that we will see in the very near future that AI becomes a standard of care for radiology.
Yep.
Excellent.
Oh, awesome. So those of y'all, as we're kind of finishing up, you can go to that slide if you want. I know that many of y'all watching this now or watching this in the future, go to my events. But if you haven't been to one of my events, I really encourage you to look it up. And if you decide to go use Pearl25 as the code, you'll save a lot of money going to the event. That savings probably will pay for your flights, your hotel. Our events are 2 days long, super intense dental business training events. And, we've got great reviews, and it's been my life's work to kind of put this thing together and do this for so many years, almost 2 decades now. So I encourage you guys to look that up. Is there any last slide you've got? If anyone wants to, I forgot about that one. Yes. If you want to listen to the Dental CEO podcast, if you're not part of the Dental CEO podcast, if you haven't subscribed, I really encourage you to. Every week we release a new episode that it's really cool. I think it's kind of a fresh air to dentistry, and I do my best to make it valuable. So please subscribe to that. Sheila, do you have any sort of slide on how to connect with you or anything like that? Or what would people do if they wanted to reach out and maybe demo Pearl or talk to someone about this?
Yep. We just have you go to hellopearl.com. And you'll be able to click on there, see some more information, and be able to get a demo for your team. It's great to bring your whole team to the demo because everybody in your practice will be able to focus on how it's going to help their day. So hellopearl.com.
And if you want to ask me a question, anyone listening to this, you can always connect with me on Instagram. We put it in the chat, but my personal Instagram, it's not some, junior account person or whatever. It's me. My personal Instagram is Dr. Scott Luna. It's dr.scott.leune. And you can connect with me on Instagram. If you follow me, you're going to see photos of my wife, my family, and my business stuff. But you can always send me a message on Instagram, and I'd be happy to answer that. Last bit of minutes we've got left here. Sheila, go ahead and take it away. What are you showing us right now?
Oh, just if you wanted to scan the QR code directly, you can go ahead and get your demo there. Happy to have you join us for a quick demo and be able to know a little bit more about Pearl's second opinion and our additional features. So I just want to make sure everybody had that if they didn't want to go directly to the website.
Okay. Well, we don't have any other questions. And Sheila, I really want to thank you for getting through the technical difficulties and sharing part of your time with us this evening to talk about Pearl in more depth than I've ever had anyone explain it to me or other dentists. So I really appreciate you doing that. I hope those of y'all that have watched felt like this was valuable, that you learned a few things, and of course that you want to use AI in radiography. Also, if you haven't watched these webinars we have a lot of them. We do them all the time on all kinds of topics. I saw a request actually to do one on AI receptionists. I think that's a great idea. So if that interests you, please try to follow these releases of these webinars, and I would love to see you guys again. All right. Any last words, Sheila, before we end this thing?
You know, I think when people ask me that, I'm always just wishing that for just a moment, you schedule a demo and see if it's a good match for you. Because the one time your patient lights up and understands the dentistry you're recommending, you'll never go back to regular black and white images. Thank you for having me too. I appreciate being here.
All right. I agree. All right. Well, thank you everyone for joining us, and I will see you next time on our webinar series. Thank you so much, Sheila.
Bye-bye.